This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Cabetag 0.25mg tablet is a medication used to manage hormonal imbalances by regulating prolactin levels in the body. It is essential for those experiencing related symptoms. Indications and uses. This medication is indicated for managing conditions associated with elevated prolactin levels, such as hyperprolactinemia, which can lead to various symptoms including infertility, menstrual disturbances, and breast milk production in non-lactating women. By effectively lowering prolactin levels, it aids in restoring normal menstrual cycles and fertility in women and alleviates symptoms associated with hormonal imbalance. How it works. Cabetag works by decreasing the amount of prolactin hormone in the body, which is crucial for various bodily functions, particularly in regulating menstrual cycles and fertility. Directions for use. Take Cabetag 0.25mg tablet as prescribed by your physician. Swallow the tablet whole with a glass of water, do not chew or crush it. It can be taken with or after food to help reduce nausea. The correct dosage and duration will be determined by your doctor based on your age, body weight, and specific health condition. Do not stop taking this medication without consulting your healthcare provider. Possible side effects. Common side effects may include drowsiness, nausea, headaches, dizziness, stomach pain, and fatigue. It is important to consult a healthcare professional if these symptoms worsen or persist. Precautions and warnings. This medication is contraindicated in pregnant and breastfeeding women. Use with caution in patients with cardiovascular diseases, liver or kidney problems, and those with a history of mental illness. Always consult your doctor before starting this medication to ensure it is suitable for you. FAQs. 1. Who should not take this medication? It is not recommended for individuals with severe liver disease or uncontrolled high blood pressure. 2. Can it help with fertility? Yes, it can help restore normal ovulation in women with elevated prolactin levels. 3. Is it safe during pregnancy? No, it is contraindicated during pregnancy. 4. What side effects should I expect? Common side effects include drowsiness, nausea, and headaches. 5. Can children use this medication? It is not recommended for children under 16 years of age. Thank you for watching. If you have any questions or suggestions, feel free to leave a comment below. Your health is important, and we are here to help.